You're going?
Yep.
Okay. So I'm going to go over all of the paperwork that we have in our clinic for patients that are admitted for surgery. The first thing that happens is that they are referred to us because we're a referral practice, or if a patient could come in through ER. In this case, Laird was referred to us, and so the referring doctor will call, and our front desk ladies will fill out the telephone referral. And this referral type is an emergency, so I'll have to, that's a correction, this wasn't a call-in, but this is an emergency, but then they'll call the doctor. And so here's his complaint, his reason for referral, that he's been excessively panting, RADs have been done, so it explains what the problem is, and then it'll explain to us what he's already had done, what he's coming with, what he needs, pertinent laboratory test, and then it's a little bit of his signalment as well. Lets us know what his rabies is. That's become, that's a recently new requirement at our clinic, is that we need to know the rabies status of our patients. Since we're new ER, that's just something that they've recently started requiring from all of our patients, is to know their rabies status. So once that's been completed and filled out, then once the patient arrives, for the parents are here as well, when they're in the room, then they'll fill out a patient form in which they give us even more information, and they'll tell us have they been here before, who their veterinarian is, what their names are, and you can see that this is just a pretty generic patient info form that gives us a little bit more information about our patients from the parent's eyes. Tells us his signalment, any kind of medications that he might be on, what you feed him and how often, when the last time that he was fed, if he's on heartworm medications, his vaccination status, and then we'll ask for their signature that they are giving us permission for treatment. The doctors and the technicians will actually fill out this part, and this is the reason that they're being dropped off in the eyes of the doctor, which isn't always the same thing as what the parents might think or what the front desk might think. This is actually when the doctors and the technicians will start filling out medically what additional problems we should know with, what the current status of the patient is, and we'll put in their TPR right there, and then the doctor will fill out do a quick little exam and put their results right here. We will then transcribe this into the computer so that it's a part of their permanent record. Once they've been admitted, then they will start to get diagnostics, or any kind of diagnostics that they come with will be reevaluated. And for instance, I printed off a copy of our ultrasound report, which looks really similar to our radiograph report written by our radiologist, and it explains what she saw on ultrasound. In this particular case, she saw that the left adrenal gland was enlarged, and that there was, she puts in the measurement. It's very medical in here, which is sometimes hard for owners to understand, so this isn't typically something that will get sent home with the owners. And then she'll also put an opinion here which just sums up the findings, and in this case this patient had a pedunculated liver mass. We have a copy of their IDEX blood work here, and this is his chemistry. You can see the results of most of his values are in range except for his ALTs and his GGTs. And then we've got his CBC is on here as well. Once we've evaluated done all of his diagnostics, and we've diagnosed his problem, we've decided the patient then needs to be treated for surgery, we will provide the owners with an estimate, and we'll have them sign it. And this is just a copy of, this is not actually the liver mass, but it's just a copy of an invoice or an estimate that we would have the owners sign in the room. And we also have them fill out a CPR or a DNR, and that's just, and once we know if it's been a CPR, once we know if it's a CPR or DNR, then we'll put these bands around the patient's neck, and the bands will also have a little sticker that shows their signalment as well, the patient's name, their reason that they're here, and who their referring doctor is, since we have so many doctors in here. That way it's a good way to know which patient you're dealing with. It decreases the chance of the wrong patient getting the wrong treatment, because every patient in the hospital should have one of these, just in case of an emergency. We know if they arrest, we know if we need to do life-saving CPR or not. And then we can also verify actually who the patient is, because you can have a lot of yellow labs in the clinic that are here for totally different reasons. So every one of our patients get one of these with their name on it. This is another form that they fill out, and this is more in depth about what we're going to do, that we're actually going to be doing surgery on this patient, and that they're going to need an Elizabethan collar afterwards. If they have any questions, they'll need to get in touch with us, and it's just much more thorough, and we'll have them sign this. We will not do any kind of surgical procedure without this signed. And then this is an example of the CPR and the DNR down here that I was explaining earlier. Every patient before it goes to surgery will have a surgery prep. This is something this is individual to our clinic. Our doctor just created this, and it's a checklist that everything that we need done before the patient can go to surgery is done. Any kind of the DNR, the CPR has been signed, that we've got all the instruments, the estimates signed. I mean, this is just down to everything, a nail trim, that the bladder is empty, that we've got medications. It's a checklist for every patient that comes in the door for surgery. Even when we're in surgery, if we've concerned that the sharps count, the gauze count's really important. And before we've gone into recovery, have we emptied the bladder or removed any kind of leg wraps and purse strings? You know, that's very important as well. While they're in surgery, we always want to keep an anesthesia monitoring form as well. Our anesthesia monitoring form is updated all the time, and it's very personalized for each patient, because it has, at the top of it, we put the patient's name and signalment, what they're getting, who their doctor is, who their tech is, what their weight is, and then our basic anesthesia log will have a list of all the different choices of drugs, and then we'll just shrink it down to what we're actually going to do for this one single patient. So we list the pre-med, and we've got what we're using, what the dosage is, and then the time for when we're going to get it. We also have up here that we'll choose if it's going to be a rebreathing or a non-rebreather. We need to fill out the E-tube size, and we'll also select an anesthetic risk. We'll want to mark our anesthesia start and stop time, and then this is how long the actual procedure lasts, and we've got ample spaces for that, because we should be checking anesthesia, checking vitals every 5 to 15 minutes, 5 at a minimum, recording them at least every 15 minutes. And then additional drugs is actually going to be for any kind of preoperative antibiotic, or then emergency drugs. This is a quick reference in case something were to happen during surgery. And down here will be any kind of additional notes that we need to put in. We'll definitely do our sponge count, suture count, and we'll fill out any pre-surgical PVC. So the patient's gone to surgery, he's filled out all of his paperwork, and we've taken any kind of, this patient, for instance, had a liver lobectomy, so that the liver that came out, the lobe, needed to go to IDEX. So we'll fill out an IDEX form, and we'll package up a sample and send that to the lab. And while the patient is here, we'll have a treatment sheet running for everything that happens to that patient. We've got the directions from the doctor right here, what happened to the patient, what his orders are for hospitalization, what kind of fluid he's running on, what kind of medications he's on, how often he wants it, and then down here is where the technicians and the doctors will fill out any kind of when the treatments are done, if the patient went out to the bathroom, what his voids were, anything that happens to that patient is going to be notated in this treatment sheet, and that's kept on the computer. We are a paperless clinic, so we have to get on the computer to fill these out. Upon discharge, we will provide the owner with a summary, and this explains who your doctor is, what the date is, what happened. He had a liver mass that was and we took the lobe out, a liver lobectomy, and it explains the assessment, which is what happened. He had a liver mass removed, and then we in writing, so the owners can look at this when they get home as well. Any medications that have been prescribed, post-operative instructions are very important for owners to look over. They're typically really overwhelmed when they're here, so there's a fun statistic that they only absorb about 2% of what's said to them in the room while they're here, so it's really important to be very thorough with these sheets, these summaries when they go home, because they can read this later and see what they need to do, any kind of feeding instructions, reading of keeping your e-collar on, follow up when they need to come back, and our contact information. We don't have this for every procedure yet that's happening in the hospital. For instance, we don't have one for liver lobectomy, but for Dr. James is working on it, and this is just an example of a surgical form of what you can expect with a laryngeal paralysis. It describes what the procedure is and what any potential complications are. It's just to avoid, the owners going on to Google and getting any kind of information. This is coming straight from the doctor, so this is information that the doctor wants the owner to have. Once we get the results back from IDEX or whatever lab we sent the samples to, then we'll have the biopsy, and this isn't something that goes to the owner either. This is for our doctors to review, but this is the biopsy report, and it will give the results of what the interpretation of what the biopsy was. And we, like I said, are a paperless hospital, so everything is online. Any kind of paper that we do have, these forms that are filled out by us, we will scan them in. This is actually an example of one that was scanned in and printed out. So anything that does get put on paper, we will scan in or dictate in, transcribe in. The paperwork that comes from referring doctors, if any kind of history, it'll be scanned into the computer as well. And then we have a running list there of everything for every patient. And that's that. You can stop.